My hope is that patients seek help before a year-long or years-long journey. So for folks that are just starting off, what are some of the first steps that you recommend?
I really recommend building a foundation because if you have a really strong foundation, even if there's Gale Force winds, the house is not going to shake as much. And so I think that that foundation includes a lot of important components. The first thing that I really recommend is creating a support system and a network. And that might be with the people in your family, with your partner. It might not be. Not everyone is lucky enough to have that kind of support. So sometimes it might mean building that support system. And maybe that's with a support group of those who are going through a similar experience. Maybe it's online. There's a lot of really good online resources, Resolve and many others, to bring those who are going through fertility journeys together. So building that support system and that social network is foundational. And then I also think it's important to think about the other components of lifestyle medicine, essentially, thinking about nutrition, thinking about movement, thinking about sleep and making sure that you have a really good sleep hygiene and routine, and thinking about all of these kind of holistic ways. Maybe it might include micronutrients, maybe it'll include certain botanicals or supplements that can help you create that foundation so that things feel like they're really stable before you embark on that kind of journey, or even when you're already in it.
Do you have any recommended botanicals or supplements that you think help patients?
There's several, and it really depends on what an individual is struggling with the most. I do have my favorites, and some of the most common ones that I recommend are, for example, I really like magnesium, and there's different forms of magnesium, but it can really help with sleep. It can help with anxiety and mood. There's some really good evidence on that. And a lot of our diets are pretty depleted in terms of magnesium. The soil that our food grows in these days just doesn't have the nutrients. And so magnesium can be really helpful. Also, particularly for those who might be predisposed to challenges with their blood sugar or anxiety, I really like inositol because it's actually been studied for mental health benefits and has been shown to be helpful, even head to head with some prescription options out there. And I would say my third favorite is omega-3s, is fish oil, because of its anti-inflammatory properties. And we know that for a lot of folks who are embarking on a fertility journey, some of the cause of whatever is going on might include some form of inflammation. And also inflammation can be a cause of depression and mood symptoms. And so reducing that inflammation with omega-3s can be really helpful.